What if I told you that diabetes can be quietly damaging your body years before you ever notice a single symptom? No pain, no warning, no obvious signs. Yet during that time, your eyes, kidneys, heart, brain, and even your nerves may already be suffering damage. Here's the frightening part. Nearly half of adults with diabetes don't know they have it. Many discover it only after experiencing a heart attack, vision loss, kidney disease, or nerve damage that could have been prevented. Today, we're uncovering the silent damage diabetes causes before symptoms appear, and the early warning signs your body may already be giving you without you realizing it. Because catching diabetes early could literally save your eyesight, your kidneys, and even your life. Make sure you stay until the end, because the final warning sign is one that most people over 50 completely ignore. 1. Why diabetes is called the silent disease. Many illnesses make themselves known quickly. You develop a fever, you feel pain, you know something isn't right. Diabetes is different, especially type 2 diabetes. Blood sugar doesn't usually rise overnight. Instead, it slowly creeps upward over many years. At first, your pancreas works harder and harder, pumping out more insulin to keep your blood sugar under control. Meanwhile, your body's cells become increasingly resistant to insulin. Eventually, your pancreas can't keep up. Blood sugar starts staying high, not just after meals, but throughout the day. And here's where the real danger begins. Sugar doesn't simply float harmlessly through your bloodstream. Too much glucose acts like tiny grains of sand moving through delicate blood vessels. Over months and years, it gradually damages the lining of those vessels. That means less oxygen, less nutrients, poor circulation, inflammation, and slow destruction of tissues throughout your body, all while you still feel perfectly healthy. 2. The silent attack on your blood vessels. Your blood vessels are like highways delivering oxygen to every organ. When blood sugar remains elevated, those highways begin to crack. The inner lining becomes inflamed. Plaque builds faster. Blood vessels become narrower and stiffer. Your heart has to work harder. This process can begin years before diabetes is officially diagnosed. Researchers have found that damage often starts during prediabetes, a condition affecting millions of people who don't even realize they have it. That means you don't have to have diabetes for damage to begin. Even slightly elevated blood sugar over time increases your risk. This silent injury is why people with diabetes are much more likely to experience heart attacks, strokes, peripheral artery disease, poor wound healing, and by the time symptoms appear, the process has often been happening for years. 3. Your eyes may be damaged before your vision changes. One of the first organs diabetes quietly attacks is your eyes. The retina depends on tiny, fragile blood vessels. High blood sugar weakens these vessels. Some begin leaking, others become blocked. New abnormal vessels grow in their place. This condition is called diabetic retinopathy. The scary part? Early diabetic retinopathy rarely causes any symptoms. You may still read perfectly, drive normally, watch television without difficulty. Meanwhile, microscopic damage continues inside your eyes. By the time blurry vision appears, the disease may already be advanced. That's why eye specialists recommend regular eye examinations, even for people who have just been diagnosed with diabetes. Because seeing clearly today doesn't always mean your eyes are healthy. 4. Your kidneys could already be under pressure. Your kidneys filter nearly 50 gallons of blood every single day. Inside each kidney are millions of microscopic filters. These filters are incredibly delicate. High blood sugar forces them to work overtime. At first, the kidneys actually filter more than normal. It sounds like a good thing. It's not. This extra workload slowly wears them out. Tiny proteins begin leaking into urine. Yet you feel absolutely nothing. No pain, no warning, no obvious symptoms. By the time swelling appears or kidney function drops significantly, years of damage may already have occurred. Diabetes is now one of the leading causes of kidney failure worldwide. But here's the encouraging news. If detected early, kidney damage can often be slowed dramatically with lifestyle changes and appropriate treatment. 5. Your nerves may already be losing feeling. Have you ever wondered why some people with diabetes develop numb feet? it doesn't happen overnight. High blood sugar slowly damages the tiny blood vessels that feed your nerves. Without enough oxygen, nerves begin to malfunction. At first, the symptoms are subtle: occasional tingling, a slight burning sensation, pins and needles, sometimes nothing at all. Over time, feeling decreases, small injuries go unnoticed, cuts become infected, healing slows. This is one reason diabetes remains a leading cause of lower limb amputations. Not because diabetes directly causes amputations, but because nerve damage allows injuries to worsen before they're noticed. The frightening reality is that nerve damage may begin long before the first numb toe. 6. Diabetes also ages your brain. Your brain consumes enormous amounts of energy. It depends on healthy blood vessels. When blood sugar remains elevated, those blood vessels suffer too. Researchers increasingly believe long-term uncontrolled diabetes raises the risk of cognitive decline and dementia. High glucose promotes inflammation, damages blood vessels, increases oxidative stress, even interferes with communication between brain cells. Some people notice subtle memory changes years before diagnosis. Difficulty concentrating, mental fatigue, brain fog. While these symptoms can have many causes, persistently high blood sugar may be one contributor. Protecting your blood sugar isn't just about preventing diabetes. It's also about protecting the organ that makes you who you are. 7. Your heart often suffers first. Here's something many people don't realize. For some individuals, their first symptom of diabetes is a heart attack. That's because diabetes dramatically increases the risk of cardiovascular disease. High blood sugar damages arteries, raises inflammation, changes cholesterol particles, increases blood pressure, encourages blood clots. Together, these changes create a perfect environment for heart disease. The danger isn't only severe diabetes. Years of slightly elevated blood sugar can quietly contribute to the process, which is why doctors now focus on preventing diabetes, not just treating it. 8. Early clues. Most people ignore. Before obvious diabetes symptoms develop, your body may whisper instead of shout. Some clues include feeling unusually tired after meals, craving sugary foods more often, difficulty losing weight despite trying, increasing waist size, darkened skin around the neck or armpits, frequent nighttime urination, needing more water than usual, slow healing cuts, recurring infections, blurred vision that comes and goes. None of these prove diabetes, but together, they deserve attention, especially if you're over 45, have excess weight around the waist, a family history of diabetes, high blood pressure, or have been told you have pre-diabetes. Sometimes the most important symptom is having no symptoms at all. 9. Can silent damage be stopped? 21 again. Here's the good news. Your body has an incredible ability to recover when given the chance. Research consistently shows that improving blood sugar control can dramatically reduce the risk of complications. Many people lower their risk by eating more vegetables, reducing sugary drinks, choosing whole grains instead of refined carbohydrates, walking for 30 minutes most days, losing even 5 to 10% of body weight if overweight, getting enough sleep, managing stress, taking prescribed medication consistently if recommended by a healthcare professional, and most importantly, getting tested. A simple blood test, such as fasting blood glucose or an HbA1c test, can reveal problems long before serious complications develop. Knowledge truly is power. Conclusively, diabetes rarely announces itself with dramatic symptoms in the beginning. Instead, it works quietly, patiently, sometimes for years. While you're living your normal life, it may already be affecting your heart, your kidneys, your eyes, your nerves, your brain. That's why waiting until you feel sick can be a costly mistake. If you're over 45, have a family history of diabetes, carry extra weight around your waist, or simply haven't checked your blood sugar in a long time, today might be the day to schedule that test, because the earlier diabetes is found, the more of your health you can protect. If you found this video helpful, give it a thumbs up and share it with someone you care about. You never know whose life it could change. And if you're interested in staying healthier after 60, subscribe to the channel and turn on notifications. Every week, we share evidence-based tips to help you protect your heart, your brain, and your independence for years to come. Remember, the most dangerous damage isn't always the damage you can feel. Sometimes, it's the damage you can't. Thanks for watching, stay healthy, and I'll see you in the next video.